Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to
It is 17 after the hour of 6 o'clock, and we're getting moving for today. It is the 27th of October, a beautiful Tuesday, and we are getting into our skin with Dr. Andrew Ford, our dermatologist. He's with us, bright and crispy. And this morning, Dr. Ford, we want to say a splendid good morning to
A
you.
splendid good morning to you,
Good
and
morning.
congratulations on your re-election to the presidency of that wonderful association. that
Yes,
you
it is a
represent.
wonderful association and
It is.
For
a
those
beautiful
who
sport.
may not know,
Mhm.
this is the bodybuilding,
Yes,
right?
bodybuilding and fitness.
Yes, excellent.
Your fourth term,
It's the fifth.
the fifth term. Oh, you know, in other countries across the world, there are laws against that.
I know, I know.
But no, I mean, you've done a
It
great
won't go
job
on
over
forever,
the years.
though. It
No.
won't go on
Mhm.
forever.
Yeah, well, there
Okay.
must be a reason that you've been reelected, so we wish you another great year. Yeah.
2 years.
And, well, another 2 years. Ah. Oh, yeah, well, we'll have those guests we expect.
Yeah.
You know.
Mhm.
Okay, good. All right. So now that we've gotten past that, we're going to get into our skin. And tell us what we're talking about today.
Want to take a shot at it?
Yeah, well,
I
it's
don't.
Erythema
Come on,
Mutiforme.
Doug. Yeah, that's pretty good. Erythema multiforme.
That's what I
Okay.
said.
Yeah.
See,
you said kind of that.
I was
Doug
close.
Doug
Yeah.
is the
Close.
man. Doug is the
Close.
man. Yeah, erythema refers to redness. Multiforme refers to a variety of presentations as it relates to shape. So this is a condition which is symmetrical, affects both sides of the body. It's an inflammation that's usually caused by infections and medications. But indeed, half of the causes of erythema multiforme are unknown. But in those situations where the causes are known, it's 90% caused by infections and 10% caused by drugs. It does start mostly on the palms and the surface and the dorsal surface of the hands with redness, which starts out as being flat, but then you can get circles with raised areas in the center or blisters. So one of the important characteristics of erythema multiforme is what's called the iris lesion, which looks like a target. Or it's called a target-like lesion or an iris lesion because in the center there's usually some redness or a blister or an erosion, and then there's a lighter ring and then a red ring around it. So
But
you
I
can
get that
actually
kind
see
of
some
condition if I
concentric
use a
circles.
hammer.
Yeah. So there's
You
an
know that?
example of it. You see that these areas are red and very
And
the
this is
center.
affecting
That's
a
a
baby,
baby.
Yes,
so it's not specific
it isn't
to
specific,
age.
but indeed most people that get erythema multiforme are between 20 to 40 years old, or more between 10 to 40 years old. It's less common in the younger age groups and the older age groups over 50.
Okay. Is there a form of this that is connected in some way to herpes simplex?
Yes, definitely. One of the major causes of erythema multiforme, as I said, mostly due to infections, is cold sores. So that's one of the reasons why someone can have recurrent episodes of erythema multiforme. Fortunately, most of those individuals have a very subtle disease that only affects the limbs and can last for a few weeks and go away, and they may only need some antihistamines and a steroid cream. But of course, erythema multiforme traverses a spectrum of severity from very mild to significant that needs
Yeah.
you to be hospitalized. So just an example of this child who got his erythema multiforme from a medication. But various medications, painkillers, non-steroidal anti-inflammatories, antibiotics like penicillin, tetracyclines, even medication used for epilepsy. So usually in the older age group, someone starts an anti-epileptic drug for whatever reason, and that's how you find out that the drug doesn't agree with you, because you get a progressively more intense rash.
Dr. Ford, when I looked this up on the internet, I saw some photos that were incredibly intense.
Disturbing.
Like, they were
yeah,
very disturbing.
only the last photo is a little bit challenging, but all the rest are quite mild. In actual fact, erythema multiforme is divided into major and minor types, but then there's an extension into other conditions. One's called Stevens-Johnson syndrome, where less than 10% of your body surface is eroded, and then there's toxic epidermal necrolysis, where more than 30%. So in those severe cases, which some people think are other conditions, that's hospitalization for you. So it's just to show you that you can get erosions from the areas that have the target lesions, and also the one on the right, you saw someone's inner thigh. It's just a lot of red, varied shapes on the
Like
No.
blisters.
Yeah.
Yeah.
Now, we are supposed to warn you about the graphic photos. Well, no, that one that we just saw, that wasn't
It just
graphic.
looked like a burn.
No, it
just
just-
looked like
just
a
a
burn.
burn.
Compared to the ones
yes.
I saw.
Yeah. Well, the problem with erythema multiforme is that your mucous membranes can be involved. So mucous membranes are areas that are not hair bearing. So we're talking about the inner lining of the eyelids, the mouth, the lining of the proximal part of the lungs, the trachea, the entrance and the exit to your gastrointestinal tract, and the genitals, because the genitals in this shows
at
you one
this
of the mucous membrane ones,
That's
just
not bad.
lips that look dry.
Yeah.
I had worse
Chap
ones,
lip,
but I
yeah.
decided to look for one that wasn't too bad. So you can just get erosions and crusting, but you can imagine that happening all throughout the inside of the mouth and in the eyes and in the genitals. And
But how do you treat that orally?
well, that's quite orally. You need disinfectant, soothing things that.
Disinfectant in the mouth.
Yes, you do. Sometimes
Wife
we
wouldn't
can.
kiss him.
We can yes, we can dilute antibiotics into gargles. Also, you need things treatment for pain and antibiotics, but you also can get oral steroids or rub-on steroids. There are steroid pastes that you can use if it's just localized. But people who have significant mucous membrane involvement need to be hospitalized and managed by a multidisciplinary group of doctors, so ophthalmologists, gastrointestinal people, dermatologists, because having all those mucous membranes involved can be quite serious. So you see, this is to let you see the target light lesions a little better on the right side, and also to show you that sometimes you can get erosions as well with erythema multiforme.
I saw a photo with this all over the body, and there was a lot of what you would call crustation.
Yes, well that would be more like the toxic epidermal necrolysis or the Stevens-Johnson syndrome. They've kind of demarcated it now, leaving erythema multiforme by itself and thinking of the worst things that you saw as other entities. But certainly you can start with the simple erythema multiforme and traverse into these
So it
severe
is
ones.
progressive?
It can be.
If you
can
don't
be.
treat
it
it.
depends on if you are a major sufferer of it or just a minor. Because most people, it's just a subtle rash that you get for a few weeks. But in those more
Does it
severe
go away?
cases, yes, it certainly goes away most of the time by itself. But if you, let's say you have a medication that causes it, and you're still on the medication, it will get progressively worse. So
Right.
most people that end up in hospital they're there because of some hypersensitivity to a drug. And they're the ones that get really bad.
I want to talk some more about that and the possibility of it being contagious and so on. But we need to take a break, and we come back and we'll continue this discussion with our dermatologist, Dr. Andrew Ford. Please stay with us.